everybody. Welcome to Resolve's Kitchen Table Conversation series. It's a new digital series hosted by Resolve, the National Infertility Association, which brings back the nostalgia of our founding around Barbara Eck's kitchen table. Ms. Eck founded the first Resolve support group in 1974, where she brought women together to discuss issues that matter to them. We are proud to carry on this tradition through our nationwide network of support groups and through this new web series where we tackle topics important to anyone challenged in building a family. Today's kitchen table conversation is titled The Male Impact on Miscarriage and Pregnancy Loss. Our head of table sponsor for our kitchen table series is Legacy. October is Pregnancy and Infant Loss Awareness Month, a time to help spread awareness about the reality of pregnancy loss and the impact is far-reaching. Pregnancy loss, sadly, is all too common to ignore and yet too personal to call common. Pregnancy loss and miscarriage can impact many different facets of your life, including mental health, your relationships, and how you navigate bereavement limitations in the workplace. But for men, pregnancy loss and miscarriage can be complicated to navigate. In this episode, we're going to unpack both the personal impact for men and the influence of men and male factor infertility diagnosis in regards to miscarriage. It's an honor to introduce this inspiring panel today. So let's go ahead, introduce ourselves to our audience. Tell us a little bit about yourself and your personal or professional ties to this episode topic. I'll get started. My name is Rebecca Flick. I'm the Chief External Affairs Officer for Resolve, the National Infertility Association. And I'm really proud to bring this group together. Let's get started with introductions. Dimitri, we're going to start with you. I'm moving around my Zoom screen here.
Hello, everyone. Thank you so much for having me. My name is Dimitri Wilson. I'm the co-founder of Kennedy's Angel Gowns, along with my wife, Heather Wilson. We're a nonprofit organization that helps support families who have lost children through miscarriage, stillbirth, and early child loss. We provide burial gowns from donated wedding dresses and donate cooling units to provide families with the gift of time. We also provide resources and emotional support to families.
Thanks, Dimitri. Megan?
Hi, thanks, Rebecca. I'm so honored to be part of this panel and participate in this conversation. My name is Megan Hansen. I am the co-founder and president of Recurrent Pregnancy Loss Association. We are a nonprofit organization with the mission to eliminate recurrent pregnancy loss. And we do that by being a community of families that's really partnering with the medical and scientific community to try to advance science. So we directly fund some research grants to investigators that are looking into why recurrent miscarriage happens, what can be done about it. We have a patient registry that is open to anybody that has experienced 2 or more pregnancy losses so that we can collect data to help advance science that way. And then we also do a lot to provide educational resources and psychosocial support to the families that have unfortunately experienced multiple losses.
Thanks, Megan. And Dr. Schlegel.
Hi, I'm Peter Schlegel. I'm from Weill Cornell Medicine in New York. I'm a urologist who specializes in the care of men who are attempting to contribute to a pregnancy. And we have significant expertise both in the evaluation and management of those men in recurrent pregnancy loss and other conditions. And I recently chaired the guidelines panel put together by both the Urology Association as well as a Reproductive Medicine Association that specifically talked about management of recurrent pregnancy loss. Thanks so much for the opportunity to be in this Resolve kitchen table conversation.
Thank you. I'm going to get started with you. We're going to start with the medical question. Can you explain to us what are some of the most common male factor contributing issues that can influence potential pregnancy loss?
Sure. Well, it used to be that the male was not even considered as part of the equation in recurrent pregnancy loss. I've seen chapters where a male wasn't even mentioned at all. But there are several conditions that we know are commonly present and can contribute to recurrent pregnancy loss and are male-derived. They include things like abnormal sperm DNA fragmentation. So an abnormality that can be present within the sperm, even though the sperm look completely normal. There also can be karyotype or chromosome abnormalities that are present in the man, even though he's otherwise completely healthy and normal, there may be a rearrangement in some of the genetic material, the structure of the chromosomes, that contributes to pregnancy loss. There are a wide variety of factors that can cause some of that abnormal sperm DNA fragmentation. We may talk about that later.
Is there one of those the biggest leading factor today, or have you seen things change over the years, discovered new factors?
Well, certainly the sperm DNA fragmentation is something that increasingly has been recognized, and that can occur for a wide variety of different reasons. It could be something simple that also contributes to infertility, like the presence of a varicocele or an infection or some medications. So all of those things sort of need to be evaluated. Basically, in large part, when a couple is having recurrent pregnancy loss, evaluating the male is important.
Do you feel that the couples are being referred to you, or getting the attention that the male factor does need early on, or does it almost become like a point of crisis?
Well, I think increasingly there is recognition. We were very fortunate that, the reproductive endocrinologist, that is the IVF doctor who is part of the male infertility guidelines, really recognized that early recognition, early evaluation of couples, both for failed IVF and also recurrent pregnancy loss, is really important.
Great, thank you. Megan, you've taken your own personal experience and helped co-found Recurrent Pregnancy Loss Association. So you're looking at this through a couple different lenses, your own personal lens, and now you're really taking on a lot of personal stories from the community that you serve. And what do you think is the biggest misconception within the general public on how men are impacted by pregnancy loss and miscarriage?
That is a good question. Misconception, I think exactly what we've talked about is I think there's a misconception about whether or not men contribute at all to a miscarriage. I think there's a general sense that it's like, okay, well, the man helps get you pregnant, and then after that, it's the woman's job. So I think that's a general misconception. I think I wouldn't necessarily frame it as a misconception, but I do think that while it's so wonderful, because I think that more and more people are sharing about their pregnancy losses, which is, it's terribly hard to share that. But I think the more and more people that share, the less taboo the topic becomes. But I still think it's maybe more of a taboo for men to talk about how they're going through that grieving process. I think that that's maybe where the biggest misconception is that it doesn't really affect them as emotionally as it affects women. And I would say that's where there's a lot still to be understood about how it emotionally impacts both members of the couple.
Well, Megan, you could not have teed that up more perfectly for me, because the next question is for Dimitri. If you feel comfortable, can you share with us how your grieving experience helped transform, you and your relationship with your wife, and talk a little bit about the resources or lack thereof that you felt that you had.
I think Megan was spot on when she brought it up, and as far as men and almost being the forgotten. As far as the emotion, we do experience those emotions. It's just not outwardly. And I can't forget that experience of being in the hospital when my wife was unfortunately going through this, of all the focus was on her. As I don't want to diminish the fact that they should receive that support, because not only are they dealing with it emotionally, but they're dealing with it physically. Mm-hmm. And sometimes us as men, I compartmentalize, I put it away. I'm the support for my family, and I want to fix it. But unfortunately, in this case, you can't fix it. So to sit there and go through that grieving process, we all have different paths and different journeys of how we deal with it. I obviously dealt with it differently, but it's not that I didn't need that emotional support. And during that moment, I didn't realize it, because I wanted all the attention on my wife. And I think that's happened a lot of time with men. When you go in there, the first thing you do is you look for the mother, and how to support her, whether it be nurses or family. I mean, you do get the occasional look and say, how are you doing? And most times, if I tell you that I'm doing okay, I'm really not doing okay. But I'm not looking for that support. And it is a major emotional deal for us to deal with. We're just not outwardly, we don't outwardly show that emotion, but we need it. And I don't think I realized how much I needed that support until years down the road, and even having our organization and having to speak with other fathers and just the visual cues. We may not speak with each other, but just visual contact, and to know that someone is there that's suffering the same way you did and has a level of understanding. So it is. I think Dr. Schlegel mentioned from the medical aspect, we're like the forgotten component, but from the emotional side, it speaks to the same volume. We do need that emotional support, whether we want it or not, because I'll be honest with you, during the stay in the hospital, if someone did approach me, I would literally tell them I'm all right. I truly would probably try to push them away. And I know that that's the levels of grieving, but it's there, it's needed. I can't express how much over time that I've dealt with other men and how much it's allowed them to come out, because it's unspoken. I didn't realize that this ever happened until I went through it, how silent it was. And I'm glad to see that it's not taboo as much, even more. But for men, it really can be encompassing, because you truly feel alone. You truly feel locked out and not getting that level of emotional support. So
what advice have you started giving men that you come across now that you've started your organization? You're interacting with these families more and more. What are some of the pieces of advice you're giving?
The first is that they're not alone in this fight. I think that's the biggest, to know there's someone else that's going through it that can help. And I mean, again, I don't think there's anything you can say. Everybody has their own way of dealing with it. But just to know that there's someone else in the room, I think that's the biggest part. It's awkward for me. I love to talk. I'm an extrovert, but when it comes to matters of the heart, I'm probably not the biggest at it. I'm not. I've known that about myself, but this almost forced me to do it. And what I realized is how much talking helped me. When we started our organization, the idea was to get out in the hospitals and support those who are going through this, suffering through this tragic occurrence. And it's funny, most times when I sat in a hospital, my wife would talk to the expectant mother, and me and the father would just sit in the room. And there wouldn't be a lot of conversation, but we would look at each other. And I start to you can see just through a look in someone's eyes how much that meant to them if they never said a word. And over time, that advice that they're not alone, and it's okay as a man to talk about it and to be emotional. It's okay to let go and let someone help you, because many times we don't seek that. We want to kind of push through on our own and be able to handle it and carry that wheelbarrow and not need help from anyone. Right. But you truly realize you need all the help to get through this, especially as a man, to know it's okay to ask for help. It's okay to talk about it.
Great. Thank you. I just want to also kind of step back and reflect that we're talking in very cisgender roles, but this also does impact our LGBTQ plus community as well. And, people who have a uterus that get pregnant, and also people that create a pregnancy with sperm. So I want to be respectful of that, but also know, stand where we are, and it's okay. You're talking about it through your lenses, but we know that this crosses over to all people. Dr. Schlegel, speaking, going back and talking about that kind of missed male factor in the diagnosis process, has there been any advancements either recently or on the horizon that may help either find out earlier and reduce risk, or prevention altogether? And you're on mute, Dr. Schlegel. Sorry.
A lot of the work that has recently been done is to help identify where these problems can come from and how they can show up in men. So, for example, a historical study sort of looked at the sperm from men who were in couples who had recurrent pregnancy loss and they saw that over half of those men had very abnormal sperm. So why did that occur? Well, subsequent work has identified that some of those men were just taking antidepressant medications of the type that are called selective serotonin reuptake inhibitors, things like Prozac or Paxil. And those can result in very abnormal sperm DNA fragmentation in half of the men who take them. So again, identifying some of these potential causes that can lead to recurrent pregnancy loss is important. You can have a semen analysis that looks perfectly normal, but have damage within that sperm that's contributing to the problem. And knowing about the fact that, you know, these medications can have effects, knowing that infections, COVID and other infections that result in a fever, that's critical if, again, you evaluate them out as part of the process of planning to get pregnant.
Dr. Schlegel, can you tell us a little bit, since I mentioned LGBTQ community and obviously those heterosexual couples with male factor, what is the donor sperm process? So if you're using donor sperm, is there anything in the process using donor sperm that would catch these things before an embryo is created or transferred?
So unfortunately, even though donor sperm are evaluated in terms of the semen analysis, the number of sperm or motility or how they're shaped, there's not a great evaluation of factors that could contribute to recurrent pregnancy loss. And so it's a small hole in the process of getting donors and having sperm evaluated. Obviously, if a donor has contributed to pregnancies previously, that's a good sign. But some of these more specific evaluations that we do in a couple are not routinely done for looking at donor sperm.
Okay. Maybe there's some research there, Megan, and I want to talk a little bit about what your organization does with research. Tell me about your grant process and what your organization's been able to fund in terms of research and investigations.
Yeah, thank you for that question. Yeah, so in terms of research, we have two, I would say two like large programmatic pillars. And one of them is direct funding of research. And so we have actually created a recurrent pregnancy loss specific research award in partnership with ASRM. So the RFP will go out, the request for proposals for the next round will go out later this fall, and it's open to any U.S. investigator that is looking into recurrent pregnancy loss. And it's a very broad, that's broad. We kept it broad intentionally. So the most recent funded award was actually a PhD out of University of Utah, and he is looking at, he's doing whole genome sequencing of couples, triads really. They take they do a genetic analysis of the female partner, the male partner, and the baby, the embryo, and are looking for really what might be some additional genetic mutations that could lead to recurrent losses that may not have been identified before. The other thing that we have is, like I said, the RPL community registry. And what that is it's really a portal that people can sign up and participate in and answer health surveys. And the only requirement is that you self-report that you have had 2 or more pregnancy losses. And you can join from any state, really any country, and answer these health surveys. And one of the surveys that's in there as part of our initial rollout is actually a male factor survey. So people can go in and answer questions about like sort of historic health, but also what had happened during some of the fertility assessments for the male partner. And hopefully that will eventually start to, identify patterns and give investigators help them ask better questions. It's not going to answer anything in and of itself, but it can help investigators ask better questions.
Now this question is not in my notes, but I just thought of something to connect it to Dr. Schlegel. How do physicians like yourself use patient registries and the information, maybe make that connection for our listening and viewing audience on why should a patient answer a registry like this? which might seem private and a little invasive. However, what benefit does it do more broadly? Just make sure, yeah.
So I think if we look at research and how it's done, research is most valuable when it's done at sort of a grassroots level, when you have broad participation. Often research studies are done at kind of specialized centers where you get a lot of important information, but it's not necessarily broadly applicable, whether it's reflective of race or ethnicity or other variations that you're going to see in the community. You can have a very selected group of people who have actually been studied, and therefore you could miss some important factors that are critical for people in general.
That brings us to the next question, which was for Dimitri, and something that I think is important to touch on. Are you seeing large response from the BIPOC community to your organization looking for support, or is that still, when we talk about the family building and infertility community, we know that there is some barriers to information within the BIPOC community and finding support. And I'm just kind of seeing how a lot of this is tying together. Patient registries are important. There sometimes is a mistrust among the BIPOC community to answer or get involved in medical research. What can you tell us in the couples that you interact with in the specifically Black community or larger BIPOC community, how they feel about either research or finding support for this important topic?
It's a really, really good question. And what we see, and I think you said it there, sometimes there can be a level of mistrust that it's in the Black community, the more to speak from my perspective or lens, that there tend to be a level of distrust and not wanting to go through the research or answer certain questionnaires for fear that it'll put them in a certain category that they don't want to be categorized as. Mm-hmm. So you're right, and it's trying to get more information out to them to show them how that's going to actually help them or help us in the future. But you're right, there is definitely a level of mistrust, and a lot of people, they do come to us for questions and to ask questions, and we try to point them in the right direction, give them the best information, or provide them someone that can to let them know what this is all about. Because just for them to fill out certain registries or forms, mm-hmm. Some can be very skeptical, is the best word, of how is this going to play and to what I'm doing in the future. So it is that's huge, and we're trying to break that and provide information. Trust me, I do understand why. There's a lot mm-hmm. of factors that definitely go into that. But we want to point them to the right direction, that they can get the best help possible, so we can prevent the reoccurring events that unfortunately happen, which is really, really high in the Black and the African American community. It's really high.
Yeah, and to Dr. Schlegel's point, if we could be missing big parts of our population who need to be part of research and need to be part of giving data. So, but we need to be mindful of the history of the reasons why.
There's a lot of history behind it. Obviously, that could take another episode to answer right. that. But because of that, we try to dispel some of it with the understanding of how it's going to help and help them navigate through certain questionnaires. Yeah, so they're given the appropriate information and knowing how it's not going to affect them in the future or affect them in a positive way.
We do have a future topic coming up on that very topic, so I will reach out to you. We look forward to bringing that to our community. Okay, as we wrap up, this has been a great discussion. I think we've hit on all the points. Research and medical, Resolve is big on advocacy, right? So advocacy doesn't always mean talking to your lawmakers. That means advocating for yourself the moment you step into the doctor's office, to having to grieve this, immense loss. I would love to start with Dr. Schlegel, and maybe if you can give one or two tips to people who are navigating recurrent pregnancy loss, a couple of tips on the way they can advocate for themselves in the doctor's office, and then we'll continue to go around and around the kitchen table, and just maybe give a couple more advocacy tips on research and support. So Dr. Schlegel, we'll start with you.
Thanks, Rebecca. I think one of the most important things for couples to know is that, a male can be a factor in recurrent pregnancy loss, and evaluation for that is valuable. What would they expect out of that evaluation? Well, they need a reasonably sophisticated male reproductive expert. And fortunately, there's not one in the area. There's a lot of those experts who will still give virtual or video visits for that evaluation. They could expect to have questionnaires about what their medical background is, blood tests to look for genetic conditions, semen tests that are specialized to look for disorders. And again, those are sort of the basic components that a couple would expect if they're trying to evaluate a male factor. And those tests are relatively straightforward. If you need any help identifying a reproductive expert, ASRM has resources to do that, as does the Urology Association, ASRM being the Reproductive Medicine Society. So a lot of ability for couples to get that information. They just need to ask.
Thank you. Megan, a couple tips on ways people can advocate for themselves during this.
Yeah. So I have maybe 2 or 3. One is, I love that you said advocacy isn't necessarily always talking to your lawmakers, and sometimes it's just raising awareness in your community. One thing that I know my husband did that he was surprised at the impact he had is that at his workplace, they have, like, at the start of their quarterly meetings, people can talk about issues that matter to them. And so he ended up sharing about our organization and his experience and the prevalence of infertility, the prevalence of pregnancy loss. And I think that was both kind of healing for him, but also as a male manager in the workplace, it opened the door for a lot of the both male and female employees that were underneath him to be more open about what they were going through, which is often something that's really hard for people. People don't want to talk about the fact that they're trying to get pregnant or they just went through this loss. And so I think leaders and organizations, if they're open with their stories, it allows other people to feel more comfortable kind of sharing what they're going through. So that's one way I think that people can do some self-advocacy. And then I echo a lot of what Dr. Schlegel said about just asking a lot of questions and not being afraid to advocate for yourself in the clinic. The DNA fragmentation analysis, for example, I don't think that's covered by most insurance plans. So it might not be something that's offered, and it might be something that if you have the means to pay for it, you have to ask for. And so, not being afraid to ask those questions and make sure you really understand everything that's going on with your care. And then the last thing I'd say, I don't know that this is advocacy per se, but I think, Dimitri mentioned men asking for help when they need it. I would say that for couples too. Recurrent pregnancy loss is incredibly taxing on a relationship. And I am always a huge advocate for therapy because people do grieve differently. And I think there can sometimes be a resistance to people wanting to bring another person into this and share their feelings. But I think that's just taking care of yourself and going and managing that part of your health. And so I would say it is self-advocacy to have a therapist to help you work through what is an incredibly, incredibly hard thing. So those are my 3 reasons.
Megan. Dimitri, we'll wrap it up with you. You're on mute.
I'm back.
There you go.
I think they hit on some really good points, and the advocacy is a big part of it. And my wife really speaks to this well, especially when you're going through a pregnancy, and especially if you suffered a pregnancy loss, is to advocate for yourself and ask the questions. My wife always says, no one knows your body better than you as far as a woman. You know your body and you know something's just not right. Ask the questions continually. If you don't feel like you're getting the answers that you're looking for, or you feel like you're being turned away and they're just saying you're going to be okay, this is normal, don't settle for that. Reach out to someone to help. My wife's a doula. Reach out to her, or there's so many levels of help that out there that can help you get the questions or help to advocate with you, that you get the questions that the questions answered that you're seeking, and not just settle for everything's be okay. Truly advocate for yourself and continue to push. As far as the emotional side of it, if you suffer that loss, I think Megan hit on it big. Therapy is huge. I can, from a personal experience, not that I didn't believe in therapy, that's not the right way to put it. I just always felt like talking to another person, you seen it as a stranger. I didn't want to express that, but the family aspect of it was so huge for me to be there with my wife. She reflects on that all the time. And I'll be honest with you, I did not speak much with our family therapy sessions, but just the support of being with her helped her a lot. And I got a lot of it. I may not have spoken often, but it truly helped me more than I ever thought when I was in there. So that the family support is huge to help you get through it. And it helps build us. I mean, man, as you well know, unfortunately, loss like this can separate couples. It really can. It's so deep and it's so hard that some couples, they never make it through it. And I think through therapy and just being there for each other, it actually made me and my wife stronger. Brought us closer together. So that whole therapy and the family aspect of it is huge.
Great point. I'm going to do one small advocacy point from Results' point of view. You know, we advocate for insurance coverage, for increasing access to IVF, but something that you can do in your workplace, to Megan's point, is you can advocate for policies, bereavement policies that cover miscarriage and